Assalamu alaikum jami'an. The lecture for today will be about restoration of endodontically treated teeth. Very important topic for you as a practitioner. Normally, when the patient comes to you for endo treatment, the patient will come only after the caries extend into the pulp, which means that there is severe destruction of the tooth structure, either by caries, multiple repeated restorations, or fracture. So the teeth required endo is already weak. And also you are going to do endo treatment procedure. So you will further weaken the tooth structure. And at the end also you have to place a restorative procedures for building up the tooth. So all this will also further weaken the tooth. So ideal root canal treatment, a tooth that has been properly treated endodontically should meet the following conditions. It should have a good prognosis, can resume full function, and can serve as abutment for a fixed or removable partial denture. So once you treat the tooth endodontically, you have to make sure that all these are there. What are the characteristics of endodontically treated teeth? The first thing is the loss of the structure because of caries, previous restorations, or endodontic procedures. Second one is the dehydration, the less of moisture compared to vital teeth, dry, which will result in a weak dentine, also micro crack because of induced by endodontic procedures. And also the most important is the appearance because of biomechanical changes in dentine, which will modify the refraction of light through the tooth structure. All these changes together will result in complicated restoration after that, which will make retention of the restoration more difficult because of loss of tooth structure. So you have to use special technique for restoring such teeth. Also, it will increase the risk of fracture during function. That's why dealing with endodontically treated teeth, you need special considerations and techniques for restoring such teeth. The special needs include ensuring both adequate retention, so you need to ensure adequate retention for the final restoration, and also maximum resistance to fracture. So both retention and resistance, you can call it as anchorage. So you need to make sure that the restoration is retentive, and also at the end that the restoration will resist fracture. The factors that influence the choice of the technique, we have two factors: the type of the tooth, whether anterior tooth or posterior, and the most important here is the amount of remaining coronal tooth structure, which is the most important indicator in determining the prognosis. So coronal tooth structure, conserving tooth structure is very, very important when treating endodontically treated teeth. So before you start to treat endodontically treated tooth, you have to do a pre-treatment evaluation. So you have to evaluate the pulp, the endodontic assessment condition. You do endodontic assessment, also periodontal assessment, restorative evaluation, and also aesthetic evaluation. First, endodontic assessment. You have to evaluate the quality of endodontic treatment. Remember, endodontic treatment should be properly done. Otherwise, you will not continue for restoring the tooth. So any existing endodontically treated tooth should be assessed for the following: good apical seal, no sensitivity to pressure, to percussion, no exudate, no fistula, no apical sensitivity, no active inflammation. Also, you have to assess for inadequate root filling. If there is any problem of this, then you will consider retreatment. So retreatment should be considered if the tooth has clinical signs of inflammation, periapical pathosis, and also if inappropriate endodontic filling material was used, like silver points. Because later on, when you are going to remove the silver point to create the space for the post, is impossible. So you have to remove it and restore it with gutta-percha. The periodontal assessment, this is the periodontal health is very important for long-term success of the teeth, and you should not start any definitive restorations before if there is any periodontal problems. Sometimes a weak tooth must be extracted, and also in cases when there is extensive coronal tooth structure, you may require a crown lengthening to re-establish a biological width or provide coronal tooth structure to incorporate the ferrule into the cast restorations. The ferrule, I will explain it later. This ferrule, when you restore endodontic treated tooth, you need to have enough coronal tooth structures apical to the core, between the core and the finish line, and it should be a minimum of 1.5 to 2 mm sound tooth structure. So we call this ferrule. We will see it later. So second one for the pre-treatment evaluation is the restorative evaluation. We start with the strategic importance. We have to see whether the final restoration depends on this tooth or no. Also, we have to check the adjacent teeth. If there is any adjacent teeth that can also help us. For example, if you have a missing tooth, like missing lower 7, you want a bridge. 8 is destructive. So here you see that the tooth, the 8 now becomes strategic. There is no adjacent teeth, so I can use them as a distal abutment. If I remove the 8, so it will be a free and saddle, especially if the patient cannot place implant or if there is any kind of or anything that contraindicate the placement of the implant. So extensively carious tooth should be preserved if its loss may affect the occlusal function or the total treatment plan, especially if the dental implants are not an option. So we have to also to take care if the tooth is strategic. So we have to do our best to conserve such tooth. The anatomic position of the tooth, we have consideration for anterior teeth. If you see the anterior teeth normally receive angular forces, not perpendicular. So there will be more tension on the lingual and compression on the labial. In the middle, where the post is there will be neutral zone. So the post will be minimally stressed in the middle. That's why reinforcement effect of post in anterior teeth is doubtful. So for endodontically treated anterior teeth, such teeth don't always need a complete crown, except when size of the restoration material limits their prognosis, which means that there is a large proximal defect, so we need a large proximal restorations, and also there is unsupported labial tooth structure. So in this case, the remaining coronal tooth structures will not retain the core material, so we need to use the post. In case of intact marginal ridge, you just place the gutta-percha and then a base and seal it with a composite resin. No need for a post because we have enough coronal tooth structure to retain the material, the restoration. In case of discoloration in absence of significant tooth loss, you just do bleaching. In the presence of mesial and distal restorations, you can use post and core before the placement of the crown. In case of extensive loss of tooth structure or tooth will be used as fixed or removable abutment, here complete crown coverage is mandatory. For posterior teeth, they received mainly vertical forces, And here, because of greater loading and also the cusps, which can be wedged apart, these teeth are more susceptible to fracture. So endodontically treated teeth should receive crown or cuspal coverage to prevent biting forces from causing the fracture. We have exception, the mandibular premolars and first molar with intact marginal ridges and conservative access cavities. Those teeth are not subjected to excessive occlusal forces, so it may not need occlusal coverage. But complete coverage is indicated on teeth with high risk of fracture. Example, the maxillary premolars. You see the cusp of the maxillary premolars, which can be easily wedged apart during function. So it needs to be protected by a crown. So if you have sufficient coronal tooth structure to retain the core, a crown is not a post. A crown and post is not needed. A post and crown is not needed because you have enough coronal tooth structure to retain the core and the crown. A post is not needed. The main use of the post is to retain the core. The main purpose of using the post is to retain the core. If I have enough tooth structure, no need to place the core. But when there is significant amount of coronal tooth structure is destroyed, in this case, post and core or amalgam foundation is needed. The other things in restorative evaluation is the amount of remaining coronal tooth structure, which is very important in clinical success of cast, post, and core restorations. If more than half of the tooth structure still remain, so conservative treatment with coronal restoration without a post is enough. If minimal tooth structure remains, which means more destruction of the tooth structure, we need post and core and definitive restoration later on. The functional load on the tooth, the force on the tooth. If you have high force or the tooth will be subjected to high force, in this case, you need a more protective and retentive features in the restoration. And such cases are bruxism and heavy occlusion, abutment teeth for long span fixed dental bridges, or abutment teeth for free end removable partial denture. The last is the of pre-treatment evaluation is the aesthetic evaluation. The appearance zone or aesthetic zone normally include the anterior teeth, premolars, and sometimes the first molar. So this zone requires careful selection in restorative materials, careful handling of the tissues, and also timely endodontic intervention to prevent darkening of the tooth as it loses its vitality. Post and core. What is post and core? It is a dental restoration used to build up a tooth structure for future restoration with a crown. You can see here the post is inserted into the endodontically treated canal after removal of the required amount of gutta percha and keeping minimum 4 to 5 mm at the apex for apical seal. And then part of it is protruded outside of the canal, so the core material will be condensed around it. So it will retain the core material, which is the main function of the post. Post crown, so last time a full coverage crown which gains its retention by post inserted in the prepared root was used. It is a one-piece crown and it is used in the past only, and it is now of historical interest and is contraindicated because a better result, a superior result can be obtained with two-step technique, meaning that we have to make first the post and core foundation, then we prepare the crown. Better than making post crown with the post and the crown cemented as one piece. So what are the advantages of two-piece technique? Better marginal fit. Remember, the crown needs to be slightly larger than the tooth, prepared tooth, for easy seating. At the same time, the post needs to be slightly smaller than the canal itself for easy seating. If it is one piece, we cannot control this shrinkage and expansion during casting. But if it is two pieces, we can control the shrinkage and expansions easily for each part. Also, if you need to replace the crown, if there is fracture of the crown, so it will be easy now to replace the crown without any need to remove the post. The third one is the different path of insertion of the crown. Here we can play with the path of insertion, especially if the tooth is going to be served as abutment for a fixed dental prosthesis. So the main role of the post, or the primary purpose of the post, as I said, is to retain the core that can be used to support the final restoration, which is the crown. So post don't reinforce the endodontically treated teeth. It do nothing with reinforcing the tooth structure. It only helps to retain the core. That's why it is not necessary or not indicated when substantial tooth structure is present, when you have enough tooth structure to retain the core. So the indication of the post is in two conditions. The remaining coronal tooth structure is not enough for the retention of the restoration, and also when there is sufficient root length to accommodate the post while maintaining the adequate apical seal. So also the root length is important. Sometimes the root is short. When you are going to place it, you will affect the apical seal, and we will see what is the recommended post length later. Advantages of post: provide good retention, ability to use the root after complete loss of the coronal portion, so you build up a tooth from the root. High aesthetic also can be achieved. Correction of misaligned teeth can be easily done. Disadvantages of cemented post: that placing the post requires additional operative procedures and also requires additional removal of tooth structure and is limited to non-vital teeth. Also weakening of the root due to improper widening of the root canal. If you are not careful, you will over enlarge the canal, and this will weaken the tooth because you remove dentine tooth structure. Root fracture also can occur because of improper canal preparation. Also, the post can complicate or prevent future endodontic treatment if this becomes necessary in the future. The principles of tooth preparation. The 6 important features of successful post and core design are adequate apical seal. So you have to maintain 4 to 5 mm apical seal. Minimal canal enlargement. You have to be conservative. Also, you have also to make a good or adequate post length during preparation. The post length can be 2/3 of the length of the root, or minimum it should be equal to the crown length. You have to provide a positive horizontal stop here, so it will prevent further insertion of the post and wedging. Also, you provide a vertical wall to prevent rotation. It will act as anti-rotation. The last is you have to finish your restoration on sound tooth structure. So you have to provide a ferrule, as I told you. ferrule between the core and the finish line, there should be at least 1.5 to 2 mm sound tooth structure. We call it a ferrule. First principle of tooth structure here is conservation of tooth structure. So during preparation of the canal, you have to only remove minimum amount of tooth structure. Over enlarging or over preparation will weaken the root and will cause fracture during function. The thickness of the remaining dentine is the primary variable in fracture resistance of the root. So you have to keep as much dentine as you can. Also, most of the roots are narrower mesiodistally than buccolingually, with proximal concavity here. And they found that most of the fracture originate from these concavities. Why? If you see here, there is minimal dentine. So the remaining dentine is the primary variable in the fracture resistance of the root. Also, when preparing the coronal tooth structure, you have to be conservative because the main cause of failure of endodontically treated teeth is fracture. So the fracture resistance of the endodontically treated teeth is related to the amount of the remaining dentine. If you maintain or have more dentine, more coronal tooth structure, the resistance to fracture will be improved. So you have to conserve as much tooth structure as possible to improve the fracture resistance. See here, in this case and in this case, you see this one is only minimal tooth structure remaining. So with this one, there is more coronal tooth structure, so it is better prognosis. So from here until here, this is the ferrule. From the end here, apical to the core material that can be placed here, till the finish line, we call it the ferrule. So ferrule is important when preparing coronal tooth structure of endodontically treated tooth, and is the extension of the axial wall of the crown apical to the missing tooth structure to enhance resistance to fracture. So the ferrule is a circumferential ring of sound tooth structure that is developed by cervical portion that is encirculated or enveloped by cervical portion of the crown restoration. See here, this is the ferrule. Here, no ferrule. Here, from here to here is the ferrule. This is the core material. And then the crown will encirculate, will surround the ferrule all around. So it's a minimum amount of sound dentine height of 1.5 to 2 mm and a thickness of 1 mm is required between the core, this is the core, and the finish line. So ferrule is very important in improving the fracture resistance. So the importance of the ferrule, it provides a bracing or casing action to protect the integrity of the root. High risk of fracture will be with teeth prepared without ferrule. It will be fractured easily than teeth prepared with a ferrule. How to create the ferrule? We can create the ferrule by extrusion, orthodontic extrusion. So we can extrude the tooth. During extrusion, what will happen? The root length will be reduced, but the crown length will be the same. So it will not be affected. So we'll just extrude it to create the ferrule only. So the crown root ratio here will be favorable, and this is preferred to the surgical crown lengthening. If we are going to do crown lengthening, we will cut bone. So the root length will be reduced, but at the same time, the height, the clinical crown height will be increased now. When you are measuring the root length, you measure the root length not from cement to enamel junction. You measure the length from the crest of the bone. So the length of the root is the only part of the root which is embedded in the bone, which is inside the bone. Once you do surgical crown lengthening, you will cut bone around the root, so you will reduce the length. The part that you have cut now will be calculated from the clinical crown. So the clinical crown will be longer, increase in the length, so it will give you unfavorable crown to root ratio. Then the minimum crown to root ratio is 1:1. So with orthodontic treatment, you will maintain this ratio. With surgical lengthening, it will increase the leverage on the root during function, because you normally increase the clinical height of the crown and reduce the height of the length of the root. What are the consequences of inadequate frill if you don't have inadequate frill? So this will lead you to catastrophic root fracture, complicated root fracture. Also, cement failure and post loosening, and also the post itself may fracture. The second principle is the retention form. In anterior teeth, the dislodgement of post-retained anterior crowns is frequently seen clinically, is seen clinically because of inadequate retention of the prepared root for the post. The post retention is affected by the preparation geometry, the post length, diameter, surface texture, and loading cement. The geometry, you need to make a parallelism. So the root canal should be prepared to give a cavity with nearly parallel wall with a minimum taper. The taper here is different from the taper for the crown. So this taper should be toward the apical. So minimum apical taper with 6 degrees to ensure the adequate retention and also eliminate undercut. In severely tapered roots, parallel side preparation may weaken the root. See here, if you have a tapered root, it is not recommended to use a parallel sided post. Tapered post is better. The retention also can be increased by using a threaded post. This threaded post, you thread it inside the canal, but it is not recommended because of the residual stress in the dentine. So you have to insert it with great care to avoid fracture. And we will see how there is a technique to reduce the stress when using the threaded post. The post length, of course, if you increase the post length, the retention will be increased. However, a too long post may also damage the seal of the root canal filling. Also, it may also cause perforation or fracture. At the same time, also, short post would provide inadequate retention and increase the risk of root fracture also, because it will easily dislodge and cause the fracture. So post should be as long as possible without jeopardizing the apical seal, strength or integrity of root canal structure, and the post length should be 2/3 of the root length and should never be less than the length of the occlusogingival height of the tooth crown. So it should minimum 1:1 ratio. And also you have to maintain or to keep a minimum length of 4 to 5 mm of root filling as apical seal. The diameter of the post should not be more than 1/3 of the diameter of the root, with dentinal walls at least of 1 mm thickness. You should not reduce the thickness of the dentine less than 1 mm. Of course, if you increase the post diameter, this will increase the retention. But if you are trying to over increase the post size, in attempt to increase the retention. This will cause unnecessary weakening of the remaining tooth structure and lead to fracture, which is not recommended. The post surface texture. How is the surface of the post? Rough, smooth. So a serrated or roughened post is more retentive than the smooth one. And serration, roughening, or controlled grooving increase the retention of the tapered post. You can improve the retention by making the surface rough. Loading agent. Normally, the choice of loading agents has little effect on post retention and also in crown retention. But the new adhesive resin cement sometimes indicated and recommended for short or dislodged post. In posterior teeth, the long posts are not recommended due to the curved roots, and amalgam can be condensed around short post or can be directly introduced into a short prepared space in the canal. We call it amalgam post, and it is effective also. If you have more than 3 to 4 mm of coronal tooth structure, posts are not needed in posterior teeth. In case of one or more missing cusp in posterior teeth, a post cemented in the distal canal of the mandibular teeth and palatal canal of maxillary teeth can be used. If 3 or more missing cusp, you can use a cast post and core in this case. So sometimes you can use the 3 canals and make a post and core, but because of difficulty in insertion, you can make it into 2 pieces as interlocking sections. So you can make the first part with its own path of insertion, cement it, and then cement the second part. But if you try to do it as one piece, it will be very difficult. And sometimes a single piece casting can be also utilized. In this case, you have to select the canal, the bigger canal, or the canal with a larger diameter, and extend the post in that canal, in the other canal, only in a short distance, because you need a parallelism. If you try to extend it more, you cannot insert it. You need to make it in interlocking sections. You need to make it into pieces. So extending into the largest canal and just small part into the other canal. The third part of the principles is the resistance form. We have here stress distribution and also anti-rotational features. As one of the function of the post and core is to improve the resistance to laterally directed forces, and the post should distribute stress as evenly as possible over a large area. So you have to avoid excessive preparation because this will weaken the tooth and increase the possibility of fracture. And the post should transmit force down to the root. So it should distribute the stress as evenly as possible. What are the influence of post design on stress distribution? Remember, the greatest stress occur at the shoulder, especially in the interproximal area, and at the apex. So what you have to do, you have to conserve dentine in those areas. Also, stress are reduced as post length increase, so we have to increase the post length into the recommended length. The parallel sided post generate high stress at the apex, but parallel sided post distribute stress more evenly than tapered post, because tapered post has a wedging effect. And remember also that parasite post can't be used with a tapered root because it will increase the possibility of fracture. Sharp angles also should be avoided because it will act as stress area. Also, high stress can be generated during insertion of the smooth post if there is no vent for the cement. So parasite posts that have no vent for cement escape is not recommended. So you have to make a groove on the side of the post so that excess cement will be escaped, and this will reduce the stress. The threaded post can produce high stress concentration during insertion and loading. As I told you, it will produce stress because it is threaded inside the root canal, so it will make wedging. But there is a technique to reduce the stress by back off of the post a half turn. Means once you set the post, you just unscrew it half turn in the opposite, unscrew it half turn, so this will reduce the stress. So back off a half turn of the threaded post will reduce the stress. The guidelines to reduce the stresses: conserve dentine at the shoulder and the apex, increase post length as possible, avoid sharp angles, provide cement vents for smooth parallel side post, and also avoid threaded post or back it off a half turn. So this is as a conclusion. The last things here is the rotational resistance. If you have sufficient coronal tooth structure, this will provide a vertical wall and this will act as anti-rotational features. But if there is no remaining coronal tooth structure, you will not get any vertical coronal wall, because any wall that is less than 1 mm thickness, you should remove it. So in this case, what you are going to do, you have to create a groove inside the root. So you select the bulkiest area, which is normally the palatal, and then you make a groove with a fissure burr, 2 mm depth in the root. So it will act, once you make the post, it will act as anti-rotation. Or you can use a pins on the root surface. So if you make a pins on the root surface, it will help to prevent the rotation. So with this, we finished the first part of the lecture topic, and we will continue inshallah next week for the second part. If you have any questions, you can ask now, please.